Welcome to our April 2021 Ambassador Briefing. We hope you all are doing well and taking good care of yourselves. In case you're wondering why you're listening to a recorded version of the briefing, we decided recordings are the most effective way to share this information without adding another meeting to your schedules. But don't worry, you'll hear in a moment about our remaining office hours for this year, where you'll be able to join and virtually ask our team about your advocacy-specific questions. For today's briefing, you'll hear from me, Kristen Crawford, and Stephanie Livingston. You'll also receive a brief update from our teammate, Stephen Schultz. If you ever have any questions, please do not hesitate to email us at advocacy@arthritis.org. And please be sure to follow our new Twitter handle at AF Advocacy. We are so thrilled to have a Twitter handle devoted solely to arthritis advocacy work. It's a great way to connect with other advocates and your legislators, so be sure to hit the follow button. As I mentioned, we have created office hours that will allow you to join and speak with members of our advocacy team. You can ask us about your ambassador assignments, bills in your state, or any other advocacy-related questions. Here are the remaining events for this year: May 19th, August 18th, and November 17th. And remember, all events will take place at 3 p.m. Eastern Time. If you're interested in joining, please register using bit.ly/2021 ambassador. And remember, you can receive credit for attending the office hours. As a reminder, our Platinum Ambassador program is here for those of you that are interested in taking your advocacy to the next level. Our requirements are the same as they were last year. We are asking that you complete 10 ambassador assignments, complete 6 bonus activities, and contribute to the Live Yes Arthritis Network. Reports are now open on the Reporting Center, and the requirement checklist is available to help you walk through each component. You can find all of this information at bit.ly/2021-requirements. In case you need a refresher about what it means to contribute to the Arthritis Foundation's Live Yes Arthritis Network, here's a quick overview of some of the things that you can do. In lieu of the traditional $1,000 fundraising requirement, we are asking ambassadors to help us expand our reach through the Live Yes Network. The 2021 Platinum Ambassador Requirements Checklist includes a list of ideas, and you'll see point values next to each one. Again, you can find that link to this document in that bit.ly from the previous slide. The activities can be mixed and matched with the goal of reaching 1,000 total points instead of that $1,000 fundraising requirement that we've previously had. Some of the activities include recruiting new advocates to take action in the Action Center, hosting a Connect group meeting to teach others about Arthritis Foundation advocacy, and of course, one of my personal favorites, participating in, creating, or recruiting for your state advocacy committee. Now, I'm going to turn this portion of the presentation over to my teammate, Stephen Schultz.
Hey there, it's Stephen Schultz, Director of State Legislative Affairs for the Arthritis Foundation, coming to you to chat about 2 of the issues that we have been most active on this year. First, let's talk about step therapy reform. As you can see, over the years, due to advocates like yourself, we've had great success in getting a lot of victories that make step therapy the process that insurers put in place that has patients try and fail medications before moving on to medications that the doctor might feel works best for that individual patient. Now, this year, we've been very active across the country in a variety of different states. You'll see those marked in that yellow color. But in particular, I want to focus on 2 states where we've had victories. The first one came in Arkansas, where we had a great effort from a variety of different coalition partners and advocates in the state that really moved that bill along very quickly and had it signed by the governor. They even had so much success that the legislative sponsor introduced a bill that focused on Medicaid step therapy, and that's currently on the governor's desk too. So great victory there. The second victory came in Nebraska, where we had a victory there, really due to so many great patient advocates and coalition partners in the state. So we're very, very excited about those 2 efforts and those turning from initially gray to yellow to now green. Now, we have a number of states that are currently active at the moment. I'll single out 2 that are getting closer and closer by the day and have already passed the chamber. Arizona has passed the Senate, very, very close to passing the House and getting to the governor's office, and we're very excited about that. So many great advocates that have assisted with that effort over the years. And then second is New Jersey, which has already passed the Assembly and is pushing really hard to make it a focus in the Senate. And then lastly, there's a few of these states that have passed an initial policy committee, and we're very excited about them moving forward, like in California and Oregon. I want to thank all of you for helping in these states, as well as making it a priority and educating legislators in states where we haven't had a bill introduced yet. Now, let's talk about the second issue, which has been extremely active on the state level this year, which is around accumulator adjustment programs. This issue surrounds copay assistance, which many patients take to afford the medications that allow them to live productive lives day after day. Increasingly, insurers are utilizing accumulator adjustment programs to restrict that assistance from counting towards a patient's cost-sharing requirements, such as their deductible or maximum out-of-pocket cost. The patient, when their assistance runs out, is then really on the hook for the entire cost-sharing requirement by themselves. This is exacerbated by the fact that often these programs are not fully disclosed to the patient before the plan year, so they're not aware or able to plan for those costs going into the plan year. So, over the last couple of years, you've seen us become very active on ensuring that all copays count. We've had a number of successes, and we have had one so far this year. That would be in Kentucky, which was enacted extremely recently, and we're so excited that Kentucky has made sure that all copays count. Now you'll see all across the country there's been a groundswell of bills that have been introduced, and I know that so many of you have been active in trying to ensure that all copays count. I'll single out some of these bills that are very, very close to crossing over the finish line. One is in Oklahoma, which is on its way to the governor's desk. It's so close to becoming law. The second is Arkansas, which has already passed the House and is in the Senate. It's passed its first policy committee in the Senate and getting very close to a full Senate vote. And then lastly, we've had a bill that has passed the House in Michigan. Now you'll see that there's so many bills active. Please don't hesitate to go to the Action Center for both accumulators, step therapy, and our other issues and take action. That's really what's going to put a lot of these over the finish line in this year or in future years. Thanks.
Thank you so much for those state updates, Stephen. It's really exciting, everything that's happening in the state level. My name is Stephanie Livingston. I'm the Advocacy Manager with the Arthritis Foundation's advocacy team, and I'm excited to chat through some of our federal updates and then walk us through our ambassador assignments for the next couple of weeks. We have 3 buckets of updates that we want to give you, and 2 of them I'm going to save for our ambassador assignments because they're what we'll be focusing on in those assignments themselves. So we'll pause on the Safe Step Act and the Pediatric Subspecialty Loan Repayment Program that you see at the top here. And I'm going to dive right into talking about CDC funding and the CDC Arthritis Program. If you joined us for the Virtual Advocacy Summit this year or for the Advocacy Leadership Retreat last year, you know that we have been big into asking for increased funding for the CDC and specifically for the CDC Arthritis Program. The CDC Arthritis Program works on programs like the Walk with Ease program and different disease management and prevention things that are especially helpful to people with arthritis. The program is currently underfunded, and we're hoping to increase its funding so that we can expand these programs and have it fully represented in all 50 states and the District of Columbia and all territories and all of that good stuff. So our top line legislative ask for the summit was $10 billion, yes, billion with a B as in boy, $10 billion of funding for the CDC, and that's in general the entire CDC. And our hope is, and you might have heard of our 54 for 54 campaign, our goal is that $54 million of that could go towards the CDC Arthritis Program. That is $54 million for the 54 million Americans living with doctor-diagnosed arthritis. And so we've talked about this. Many of you have met with your legislators to talk through what this kind of funding could mean for people with arthritis and all across the CDC. And you might have heard about appropriations request forms or appropriators or anything like that. And now it's officially appropriation season. So exactly, what does that mean? It's a big word and something that we're not as familiar with. So the president recently came out with their budget. And so now our legislators know what kind of flexibility, what wiggle room they're working with to be able to submit their appropriations requests, which is a document essentially that will go over everything that they think should be funded at what level and everything like that. So all of the important asks and meetings that you had over the past couple of months and really in the past several years, if you've been talking about CDC funding and public health funding, will come into play now. So appropriations are going to start moving forward, and we're really hopeful that we'll be able to get this important funding moving forward. And we'll talk a little bit more about appropriations because that is where our pediatric loan repayment program comes into play as well. So we'll jump right into the Safe Step Act. Before we dive in, this is a brief overview of what our new assignments for the next month or so look like. We'll be going over each of these in depth, and if you take a look at your ambassador update, the newsletter that you are probably accessing this video from, you'll be able to access the assignment guide that I'll be mentioning throughout this portion of the video and learn a little bit more about these topics as well. So let's jump in. Let's get started with none other than the Safe Step Act. So we're really excited that the Safe Step Act, this is legislation to reform step therapy, was reintroduced in the House and the Senate this year. And that's S464 in the Senate and HR 2163 in the House for those bill numbers, in case you want to jot them down. They're on the screen as well. So we have, as of this video on April 14th, 2021, there are 13 co-sponsors on the Senate bill and 3 on the House bill. And so we're excited to see this co-sponsorship grow because we know that the more co-sponsors any given bill has, the more support it has, the more kind of leverage or ability it has to get across the finish line or move to the next level. So we're asking you as ambassadors to take some time to do some next level research, look into your legislators and find out if they've been supportive of the Safe Step Act in the past. If they're a new legislator, you can be sure to include a little bit more information about the Safe Step Act, about what reforming step therapy will do for patients like yourself or your children or your loved ones. And make sure that you personalize that message so that we can be sure that the right eyes are seeing it and that it's really being paid attention to. So you'll see in the assignment guide that's linked at the bottom of this screen and also in the ambassador email, the ambassador newsletter that you received today, you'll be able to look through our assignment guide and learn a little bit more about the steps that you can take to really personalize your ask and maximize your impact. So you'll be looking in to your legislators again to see if they co-sponsored the Safe Step Act in the past to encourage them to do it again. If they are a returning legislator that was not supportive in the past, you can look back on why they might not have co-sponsored. Did they not hear from someone, or were they just a little reluctant? And you can include a little bit more information about the issue that's included in the assignment guide to really push them over the edge and encourage them to co-sponsor. And then, like I mentioned, if you have a new legislator, you'll be able to teach them about the issue maybe for the first time or one of the first times. There's also instructions in the assignment guide for how to contact your legislators or their staff in our Action Center and our legislator lookup tool. And then, of course, it's always important to amplify the message, amplify the action opportunity, and you can share the opportunity to take action with your community. So we're excited to see all of your stories come through and to see how you can get in touch with your legislators and increase co-sponsors over the next several weeks and months. We're excited to see this piece of legislation get across the finish line. Our next assignment is all about the Pediatric Subspecialty Loan Repayment Program, or PSLRP. So a little bit of background on the issue for those of you that might be a little bit less familiar. There is a severe shortage of pediatric rheumatologists, that is specialists that are specifically trained and certified to treat kids living with arthritis. There's a severe shortage in the United States. There's fewer than 450 board certified and practicing pediatric rheumatologists to treat these young people that are diagnosed with arthritis. You can see a map in your assignment guide that you'll be able to look at to see how many pediatric rheumatologists are in your state. And even if you see a high number of pediatric rheumatologists, we know that a lot of them are most likely centered around bigger cities, and that in big states like Texas or California or somewhere like that, a child might still have to travel a long, long way to be able to see their provider and get the care that they need. We know that kids with arthritis need to be treated especially quickly to help them get the care that they need and get on the right track with their medications or their treatment so that they can get on the right track as young as possible. So with this shortage of pediatric rheumatologists, there is a solution, a potential solution, or something that can help with this a little bit. And like I mentioned, that is the PSLRP, again, Pediatric Subspecialty Loan Repayment Program. So this is a program that is authorized and funded by Congress that offers loan repayment to pediatric subspecialists, which includes pediatric rheumatologists, that choose to practice in rural or underserved areas. So this could be in any corner of the country, anywhere where there is a pediatric rheumatologist needed, anywhere that maybe does not have one or does not have access to one. The program was reauthorized in the CARES Act, one of the coronavirus packages in 2020, which is very, very exciting. So it was essentially approved, but it was not given a funding amount. It wasn't funded, as we say. It wasn't assigned a dollar amount for how much money the program could use. So it's essentially approved, it has the green light to start, but it doesn't have the resources to be able to start, if that makes sense. So now Congress, in this appropriations process that I mentioned earlier in this video, needs to allocate a funding amount to this program. In this assignment, you'll be taking a look at some of the background on your legislators to see if they sit on a key committee that handles appropriations, or if they are appropriators that are on the committees that have the ultimate say on what these funding amounts, what the budget overall will look like. You can also take a look at the workforce shortage map that you can see a little bit of a preview of on this screen, and make sure you include all of this personal, specific, state-specific information and legislator-specific information to, again, tailor your message, personalize your message to the specific person that you're talking about, or talking to and talking about. You share your story and you make sure that you include something that will resonate with the legislator or their staff to make sure they're really paying attention. So we're excited to see all of your stories and your messages come through. You'll be able to walk through step by step in the assignment guide through the background of this issue, a little bit more about the program, how to do your research and really personalize your ask. Since you are an ambassador, you can take your advocacy to the next level and do this sort of background research so that you can maximize, again, your impact on your ask and really get this across the finish line. So if you have any questions on this, it's something that we've been working on for a handful of years now as well in different capacities. We're happy to answer any questions that you may have. So you can again see the link to the assignment guide at the bottom, and we're excited to see your stories come through. Our final formal ambassador assignment for the month of April is around inviting your community to join us in advocacy, in arthritis advocacy. We know that a key part of advocacy is raising awareness. We know that one of the biggest barriers to getting somebody to say yes to something is them knowing that it is even an issue, knowing that arthritis is as big of an issue as it is, that it affects 1 in 4 Americans and more than 300,000 kids, is something that not most people know. So part of what we do, a big part of what we do as ambassadors, as advocates, is to raise awareness. And a great way to do that and to make sure that your community is staying in the loop, and your community being your friends, your family, anyone that you interact with if you are in a church or other social group, a book club, whatever it may be, it is a really great opportunity to share some of the resources that we have. They may not be an arthritis patient or connected to the arthritis community other than through you if you're a patient or a caregiver or a provider yourself. We'd love to loop them into the community so that they can just stay at base level in the know of what we're doing. And so we have 2 different ways that we'd love for you to encourage your community to join us. There is absolutely no commitment required for either one of these. You can let your people know that in either one of these capacities, they are not required to do anything. There is no financial component to it or anything like that. We just want to make sure people are staying up to date and that we're able to call on people to take action for issues that they are really interested in. So without further ado, the first way that we would love for you to encourage your community to join us is on Twitter. We have a brand new Twitter handle that we launched just in February, shortly before the Advocacy Summit. Our handle is at AF Advocacy. It's AF Advocacy. It's listed on the screen here and it's linked in the email a few times as well. This is where our team is giving you real-time updates on bill activity on the federal and state level, any sort of pertinent news alerts. It's new ways to connect with other advocates and ambassadors. We're sharing your stories that you send to us and new ways to take action. You can tag us to have your story featured. It's a great way to stay connected to your legislators and their staff. A lot of them interact with us on Twitter in that way, and it's really exciting to see a like come in from your state representative or a state senator, or even your federal legislators too. Like it says here, it's a great place for one-on-one interaction with legislators, staff, and then our other patient advocacy organizations that we partner with. So we'd encourage you, of course, to follow us on Twitter so that you can stay up to date real time, because we don't want to send you too many emails. We know that there's a lot of email fatigue nowadays. And then encourage your community to join as well. You can send those updates to people directly, but if they're able to have a one-on-one connection with us on Twitter, that's another great way to do so. And for people that are not on Twitter, of course, we want to have another touch point, and that is, of course, our Advocacy in Action newsletter. And we have a link here that you can send people to sign up for the newsletter. This is the newsletter, the email newsletter that you receive on the first Wednesday of each month. It includes advocacy and policy updates, any event information, action opportunities, the things that we need advocates to take action on now. Again, there is no commitment associated with this newsletter. You are just signing up to receive this monthly newsletter. If you're an ambassador, you already received this newsletter, so you don't need to do anything double. Essentially, if you are watching this video, you are an advocate and you have already been signed up for this newsletter. So anybody that you in your community that you think should really get involved at a new level and hear about the things that we're working on, or if they want to learn a little bit more about specific policy issues, sending them to the Advocacy in Action newsletter is a great way to do so. So as an ambassador assignment, we encourage you to invite your community, your friends, your family, your coworkers, whoever it may be that you think could be interested in this, invite them to follow us on Twitter or to sign up for the Advocacy in Action newsletter. You'll be able to report your activity back in the reporting center and earn some ambassador credit for doing this as well. So it's a win-win, really. But we know that we need to bring new people into our community continually to be able to keep growing and learning new things about what is affecting arthritis patients and learning new ways to advocate in real time. So we hope that you will take us up on this and that we'll see some new faces on Twitter, some new people in our email newsletter, and let us know again if you have any questions. On behalf of the whole advocacy team and on behalf of the Arthritis Foundation, thank you so much for being an ambassador, for taking your advocacy to the next level, and for joining us to walk through all of these exciting state and federal updates, ambassador program updates, and assignments for the next couple of months. We will see you on May 19th for our ambassador office hours, where you can join to ask the entire team questions live. That's anything from policy issues to arthritis access challenges you might be facing that you'd want to let us know about or ask questions about. You can ask about the ambassador program. You can ask Stephen about his favorite reality TV show, anything in between. But we're excited to see you there. Feel free to send your questions to us in the meantime at advocacy@arthritis.org, and we're excited to see you on Twitter.